Hi everybody, I'm Mary Kay, and I started this channel so that we could all start talking about hereditary angioedema and sharing our experiences. This last month has been a long one for me. I fell and broke and dislocated my elbow, which was pretty gnarly, and I ended up having to have surgery 2 weeks ago. So I just had my cast off yesterday. Unfortunately, I did not have the state of mind to make this video before they took my gigantic cast off. But yesterday I went and I got this guy, which is pretty fantastic and gigantic. Anyway, so I thought that I would talk a little bit about the surgery and how I prepped for that and my HAE. You know, when I fell, I broke my arm. It was broken for 2 weeks before they set it, so I kind of laid around for 2 weeks and took drugs. The night that I fell, which was actually New Year's Eve, I hadn't even been drinking. It was at 8 o'clock at night, and I just fell off my porch. When I went to the hospital, my arm was blowing up. It was gigantic. So I took my Firazyr with me, and the nurse gave me a shot of Firazyr. Because I couldn't do it with my left hand. I wasn't quite doing things with my left hand yet. And so when I came back, I had a partial cast on and it was wrapped and it blew up like crazy. But then it sort of mellowed out and it was okay. And I was taking Norco for a couple weeks just for the pain so I could sleep and wait for surgery and all of that. And then when I finally did the surgery, they basically, you know, cut my elbow open, reset everything, put screws in the broken pieces, and reset everything, and then put it in a big gigantic cast with a seam down it. And when I went in for surgery, I talked to the anesthesiologist ahead of time. I talked to the doctor ahead of time. I told them about my HAE and my fears, my biggest fear, of course, being that like my throat would swell up during surgery. So I brought in my Baronert, and they infused me about 30 minutes before they took me into the ER. Everyone was very cool about it. I had to reconstitute it and get it all ready for the nurses because they had no idea what to do with it. And then I brought a Firazyr and I gave that to the anesthesiologist. And he took it in with him and then gave it back to me afterwards because he ended up not having to use it. And, you know, immediately afterwards I didn't have any complications. So other than normal swelling, I've been, you know, very swollen, very bloated, very kind of, you know, out of it since my surgery. But each day gets a little bit better. And now that I have this, I have to kind of move around more. So I went out today and finally walked around a little bit. Walked around the park. So yeah, so I feel pretty good. I don't have any movement yet. My mobility's gone so far. But I start physical therapy on Thursday. And you know, there's that. So my biggest fear was that there was going to be some sort of horrible complication. But when I spoke with my doctor, he said, you know, if you do your Baronert less than an hour before surgery, you should be fine. And I guess it went off without a hitch. So that's good news. So if any of you are thinking about having to get surgery, that's my tip. Use your Baronert. If you don't have Baronert, try to get it. Maybe Cinryze, something, and then have some sort of rescue plan. The doctor had me sign a form, the anesthesiologist, excuse me, had me sign a form also right before I went in, allowing him to give me fresh frozen plasma if he needed to. And I said, fine. I'm like, do whatever you need to do to make me come out of this. But yeah, so there's that. If you have any questions about my surgery, I'm happy to answer any questions. If you have any questions about my broken arm, I'm happy to answer those. And I really hope that some of you will start contributing videos. I would love to have this channel be all of us sharing our experiences, you know, talking about the drugs you're on, talking about your doctors, talking about frustrating ER experiences. Hopefully I will progressively look less and less like a homeless man as I'm able to actually brush my hair. So yeah, that's that. But so far so good. I'll keep you posted on physical therapy, and I have lots of other stuff to talk about too, so we'll talk about that. And I hope you're all feeling well, and we'll talk to you soon. Bye!